I am Dr. Anuradha Pichumani, Chairperson of the Quality Professional Wing of CAHO. And CAHO is a non-profit organization dedicated to promoting patient safety, quality, and accreditation in the healthcare quality ecosystem. And through structured training programs aimed at imparting relevant healthcare quality skills to various grassroots healthcare workers, CAHO has trained more than 10,000 clinical and non-clinical healthcare professionals till date. And CAHO is an institutional member of the ISQA, the International Society for Quality in Healthcare, and also an elected member of ASQA. So this webinar is organized by the Quality Professional Wing of CAHO. And this is one of the three main verticals of CAHO. We have the CAHO leadership here with the President, Dr. Vijay Agarwal, and the Vice President, Mr. Samit Mehta, the Secretary General, Dr. Lalit Joseph, and the Financial Secretary, Mr. Sunil Kumar Sagar. And we have a chairperson and a vice chair, Dr. Suvin Shetty, and the secretary, Dr. Anna George, heading the CAHO quality professionals, along with 82 professionals in this wing. And CAHO, in association with ASQA, the Asian Society for Quality in Healthcare, has been doing this virtual session. It's been a fora conclave on a particular theme every month. And we have been conducting it through last year. And I thank Professor Pichumani, the president of ASQA, for that collaboration with CAHO on this webinar series. Warm welcome goes out to Professor Chu and Chang, Far Eastern Memorial Hospital, Taiwan, and also the designated speaker from ASQA. I also welcome all the board members and members of ASQA and members of CAHO and all the participants to this session. Each edition of this series has been coordinated by Center for Quality Promotion of CAHO, and I welcome Nirmal Sai Hospital, Chennai, and Zamindar Microsurgical Eye Center, Bangalore. I welcome our knowledge partners, the All India Ophthalmological Society, its President, Dr. Lalit Verma, and the Honorary General Secretary, Dr. Namrata Sharma. Today's session is aimed at educating healthcare workers across India and elsewhere on the best practices to adopt and implement with the goal of improving the patient safety and quality in delivery. The theme of today's session is on ophthalmology standards, and I welcome all the faculty to the session. Today's program will also have amongst its audience students graduating from the CAHO Shankar Nethralaya Certified Professional in Healthcare Quality Management class. And for this special occasion, I welcome Dr. Vijay Agarwal and also Dr. Anuja from Shankar Nethralaya and all the students who are celebrating this convocation. And on behalf of the governing committee of CAHO, I welcome everyone to this program and look forward to an engaging session of all the speakers and the participants. I now request the organizing chairperson, Dr. Nirmal Frederick, Chief Eye Surgeon and Managing Director of Nirmal Sai Hospital, Chennai, to take the proceedings forward and introduce the organizing team. Over to you, sir.
Yeah. Thank you, Dr. Anuradha, and welcome all of you for this ophthalmology webinar. So I thank CAHO for this, CAHO and the Asian Society for Quality in Health for this wonderful opportunity. And also thank All India Ophthalmic Society for joining us. And I hope the president will be joining us soon. Thank you, Dr. Namrata, for joining us, and CIPLA for supporting us in this venture. So let me welcome the speakers, the faculty, and the panelists first, and also our ASQA member, Professor Dr. Shu-Wen Chang from Taiwan. Thank you, Dr. Chang, for joining us. And this program, as Dr. Anuradha mentioned earlier, every month they have a theme, and CAHO has been spearheading this education front on various themes. And this month is about ophthalmology standards. And ophthalmology, as you know, is a major subject in India, and it's a fast-growing specialty. And there are a lot of independent standalone centers and huge institutions. And we deal with huge number of patients because of the outreach aspects as well as the number of people in our country with eye ailments. with the increase in life expectancy, the lot of non-communicable disease and age-related problems are cropping up. And with that, the quality issues are also cropping up. So apart from giving the high advanced care, we also need to provide affordable and appropriate care to our patients. And therein comes the importance of quality eye care delivery system. We have a well-established community outreach system in our country, but thanks to the NGO organization and the teaching institutions. But if there is a negative incident that is being that really affects the service and also gives a bad name to the industry. So apart from
Hello. Yeah.
Thank you, President Sir, for joining us. Welcome, Dr. Lalit Verma, the President of All India Ophthalmic Society.
My pleasure.
Apart from these issues, there are a lot of advancements happening that actually helping us to take ophthalmology to the doorstep of the people. I'm very happy in this regard because ophthalmology got the special privilege of being the first specialty specific standards with NABH. We had a lot of issues from the hospital side and also concerns from the hospitals that the general standards are very difficult for the eye centers and it is not specialty specific. So with the help of All India Ophthalmic Society and NABH, we got this NABH eye care standard 6 years back. So a team of professionals, quality professionals and ophthalmologists worked on this, and we were able to launch the NABH eye care standard in September 2016. Since then, many organizations got interested, and we now have over 300 accredited eye care hospitals and another 20 waiting for the accreditation, and a lot of eye centers in the entry-level stage. And many of the small eye care institutions are also on their way to get accredited. So this quality movement, quality in eye care is gaining momentum. And this initiative from CAHO, along with the Asian Society of Quality, would be a welcome thing from the ophthalmic professionals' point of view. I'm sure with all your help, we'll be able to take this initiative forward to reach out and to the common man, as well as give quality eye care to our people. So welcome to the ophthalmology standards of this webinar. And with this introduction, I invite the introductory remarks from the President of All India Ophthalmic Society. Dr. Lalit Verma sir is currently the President. He is worked in All India Ophthalmic Society and worked as a administrator and office bearer in All India Ophthalmic Society in various capacities, and recently scientific committee chairman, and had a wonderful tenure and helped us in having a lot of quality programs in the scientific sessions, as well as now he has taken over as a president. I'm sure he will be helping us all through his tenure in taking this initiative.
So thanks, Nirmal, for having me here. You see, as Dr. Nirmal was saying, two things are important. One is safety, one is quality. And these two words, caught my attention a long time back. In fact, once NABH was coming up, you see, India is a unique kind of country. We have no uniform kind of setups. So there will be very good hospitals who take care of quality, who take care of safety. But there are huge number, as Nirmal said, only around say 300 odd, are accredited. But a lot of work needs to be done in this standard. Because ultimately, remember, we have to win the hearts of people so that they have trust on us. The element of trust has to be there so that they know that quality standards of quality are being maintained here, and patient feels assured that if he enters a NABH accredited center, he will receive the best possible services. So this CQC, I'm very happy that you see it is being done. in association with Asian Society of Quality in Healthcare, and AIOS also joined this. And all of you know that CAHO is a not-for-profit organization, and their primary goal is to enable quality initiatives in healthcare and in India as well as across the globe. And the theme today, as was being brought up, is ophthalmology standards. And topics you will come to know what are being covered. So I highlighted two of them. One is quality indicators and other is patient safety, because these two, to my mind, are the most important, which convinces the public at large that why accreditation is important. And there are two panel discussions very important again on safety and quality. And I'm happy that you see Supla has jumped in to help us talk about this ophthalmology standards in this very important webinar. Although I would have actually preferred in person, but nevertheless, you see, COVID has taught us that online we can do equally good job in this education series. And I'm very happy that you see we have very high quality speakers, Dr. Gagan Nirmal himself. Then we have Dr. Chang, Dr. Samina Zamindar, again, a very big name as far as NABH is concerned. And then panelist Dr. Chandrasekhar Nutan and Dr. Patil, Supriya, BK Gupta. And we have the other session, which will be, we will have speaker from Jaipur, from Dr. Senthil himself. Then our own Dr. Mandeep Jyot Singh, he takes care in center of side. Will tell us about the quality indicators of ophthalmology. Then patient safety. As I said, this to me is the most important thing. And also the how to do the auditing, because without audit, nothing succeeds. And then Gagan is already there, Chandrasekhar and Matthew Korean. So I'm not going to come in between you and this very important seminar. And I thank Nirmal as well as the Organizing Secretary, Dr. Samina, for bringing this webinar here. And we'll talk about the ophthalmology standards in this. Thank you, Nirmal, for having me here.
Thank you, President.
Yeah, thanks a lot.
Thank you, Dr. Lalit Verma. Thank you, President, for this introduction and highlighting the importance of the various aspects of quality and safety in eye care. May I invite Dr. Namrata Sharma, the Honorary General Secretary, to say a few words. Dr. Namrata needs no introduction to this audience, to the dynamic General Secretary of, as well as Professor of Ophthalmology from All India Institute of Medical Sciences. Over to you, Dr. Namrata.
Thank you, Dr. Nirmal, for that introduction. Thank you, firstly, for organizing this. And we are really thankful to CAHO, as well as the Asian Society, and particularly gratitude to Dr. Nirmal Frederick and Dr. Samina Zamindar, who are our ambassadors in as far as quality of eye care is concerned. They are the leaders and they always take it up forwards for organizing this with CAHO and with the Asian Society. Of course, I think ophthalmology that way is a different branch in the sense quality care is very important because the turnover of the patients is so rapid. The surgeries hardly take any time as far as the cataract surgery is concerned. And so as a result, the turnover of the patients is huge. The use of the consumables is huge. And there are varying varieties of consumables, some off-label, some on-label use. That is again something which one needs to discuss about. And that is why quality eye care and safety of the eye becomes so important. And many congratulations for doing this. And thank you for involving All India Ophthalmological Society. Thank you once again. And Dr. Nirmal Frederick now for the program to take it further.
Thank you, Madam. And so I request the President and Secretary to help us in taking this initiative to all the ophthalmologists. And we'll also be requiring a lot of requests from the members on the daycare center initiative, because the regulations are becoming strict, the higher courts are becoming very stringent. So I think as a specialty daycare center, we need to work for the daycare initiative so that the regulation are a bit less stringent on others. Of course, we need to maintain regulations, but we would need your help and initiative in this regard.
Yeah, Nirmal, rest assured, believe me, this is so close to my heart. And whatever the deliberations come out of this important webinar, at AIS level, we will, push it forward with your help and Dr. Samina sir.
Thank you.
Thanks a lot. Thank you.
Thank you. Thank you so much. We now move on to the program as such. With me, I happy to introduce Dr. Samina Zamindar, is an ophthalmologist and managing director of Zamindar Eye Hospital in Bangalore, and is a quality professional as a passion, even though she is an ophthalmologist, a communicator par excellence, and very passionate quality professionals. I'm happy to organize this initiative with Dr. Samina. And along with me, I have the MC for today's program, Ms. Shweta Shaket Bandol. She is a general manager of quality. Pushpagiri Vichyaratna Institute is one eye hospital who started the quality initiative much ahead than any other hospital in our country. And she's in charge of the quality initiatives at PVRI. And she's not only a quality professional at present, I think she's also doing a leadership course in quality. I'm sure her experience will help us in taking this webinar through this 4 hours. Welcome, Shweta.
Thank you, Dr. Nirmal sir.
That's over to you. We can go on with the academic program.
Yes, sir. Thank you.